Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show. Welcome to MS&Me Interviews. I am your host, Erica Lyons Richardson. This is part 3 of our annual ACTRIMS review, where we take a look at highlights from research presented at the ACTRIMS Forum. The 4th Annual America's Committee for Treatment and Research in Multiple Sclerosis, or ACTRIMS, Forum 2019 was held February 28th through March the 2nd in Dallas, Texas. Themed Precision Medicine Approaches for MS, Scientific Principles to Clinical Application, this CME accredited meeting stood apart from many traditional medical meetings by offering a singular track of scientific and clinical presentations in an interactive environment, as well as numerous networking opportunities. Highlights of the forum include the Kenneth P. Johnson Memorial Lecture and the National MS Society's Barancik Award presentation and talk. In addition, 2 poster sessions showcased approximately 200 posters. ACTRIMS Forum 2019 provided an excellent opportunity to interact with scientists and clinicians at the cutting edge of MS research. The inaugural ACTRIMS Forum held in New Orleans in February of 2016 was a great success with over 600 participants, well surpassing the original projection attendance of 250. Year after year, the ACTRIMS Forum continues to have record-breaking participation with nearly 1,000 in attendance in 2018. The MS&Me media team had an amazing time serving as press in 2018 in San Diego. ACTRIMS continues to further its mission of providing leadership in the field of multiple sclerosis and other demyelinating diseases. Now on to our first topic for part 3 of the review. Botox earns high marks from patients, physicians as treatment for spasticity, the ASPIRE follow-up finds. Patients with a range of diseases and disorders, including multiple sclerosis, report high satisfaction with botulinum toxin, also known as Botox, as a treatment for their spasticity. Results from the clinical trial showed. Now, the data was presented by Dr. Daniel S. Bhandari from the MS Center of California and Research Group at the Hoag Neurosciences Institutes at the ACTRIMS in Dallas, Texas. His poster was titled, Individualized Onabotulinum A Treatment for Spasticity in Multiple Sclerosis Resulted in High Patient and Clinician Satisfaction, the ASPIRE Study. Botox is approved by the U.S. Food and Drug Administration, or the FDA, to treat muscle spasms, spasticity, and bladder symptoms in patients with a spectrum of diseases, including MS. It is estimated that 6 to 9 of every 10 MS patients experience spasticity at some point. In collaboration with developer Allergan, an international team of researchers examined real-world data on the effectiveness of Botox to treat spasticity in a study called ASPIRE. Researchers also assessed both patient and clinician satisfaction with the treatment. The ASPIRE trial is a prospective international multi-center observational study in centers across North America, Europe, and Asia. It examined 730 adult patients. The average age was 53.6 years with spasticity symptoms. Now, in this patient group, the most common diseases were stroke, which was 56%, followed by MS, which was 16%. Of the initial patients, 397 completed a 2-year follow-up period. Researchers observed a wide range of injections in the upper and lower limbs. The anatomical location and the EMG localization were the most frequently used injection guiding methods in the upper and the lower limbs, respectively. In MS patients, the most common treated was upper limb spasticity for flexed elbow, and the most common lower limb presentation treatment was for equinovarus foot, in which one or both feet are rotated inward and downward. So overall, clinicians and patients were satisfied with the effectiveness of Botox in easing spasticity symptoms. The majority of the patients and clinicians were satisfied in the patient's ability to participate in therapy and in both, also in exercise. Dr. Bhandari said, and he was specified that 72% of the patients and 91% of the clinicians, the majority of them, indicated that they would continue to use Botox treatment for spasticity. After the study's end, specifically 92% of the patients and 98% of the clinicians made that statement. Now, regarding safety, 261 of the initial 730 patients reported 831 adverse side effects. Now, of these, only 23 were considered treatment-related. The most common treatment-related side effect was muscular weakness. Overall, the team concluded that the results add to the body of evidence on the safety and effectiveness of Botox for the treatment of spasticity. Dr. Bhandari also emphasized that Aspire provides valuable real-world data which may help guide clinical strategies. It also captured the individualized nature of Botox utilization for spasticity in MS patients, while consistently demonstrating that high satisfaction among patients and clinicians. Our next topic is bacterial epsilon toxin found in MS patient triggers MS disease features in rodents. Now, as you know, just to note that when you're dealing with laboratory research versus actual patient use research, you know that it's very early research data and more research will have to be done to confirm any actual data in patient treatment. Okay. The levels of epsilon toxin are increased in MS patients, and its presence in laboratory rodents replicated some aspects of disease activity according to the data presented at ACTRIMS. The researchers suggested that the epsilon toxin and the bacteria that it produces, called Clostridium perfringens, may play a role in MS development. Okay, the data was presented at ACTRIMS by Dr. Jennifer Linden from Weill Cornell Medical College, New York, in a poster titled Clinical and Mechanistic Evidence for Clostridium perfringens Epsilon Toxin as an Environmental Trigger of Multiple Sclerosis. So the Clostridium perfringens is a bacterium that is part of a family that synthesizes some of the most potent toxins, including tetanus and botulinum and neurotoxin. These bacteria are found in all sorts of environments, i.e. decaying vegetation, soil, and water, as long-lasting or dormant spores where they wait for an opportunity to infect livestock or humans. The Clostridium perfringens produces the epsilon toxin called ETX, which has been suggested as a possible environmental agent linked to new MS lesion formation. The researchers from Weill Cornell wanted to better understand the relationship between the ETX and MS. They had two questions. Do MS patients have increased exposure to this bacterium and related ETX? And does ETX administration mimic MS disease activity features in the rodents? So, the team offered a hypothesis of how ETX causes demyelinization in MS patients according to them. For our model of ETX-induced MS, we propose that ETX-producing bacteria colonize the human gastrointestinal tract, resulting in periodical blooms of exponential growth, leading to the secretion of the toxin. Okay, then the activation of the ETX induces intestinal permeability as well as accepted but poorly understood process, allowing entry of the toxin into the bloodstream. Once in circulation, ETX specifically binds to the central nervous system, their microvasculature, causing the blood-brain barrier permeability, in other words, breaking that blood-brain barrier, and allowing the entry of the toxin into the brain cellular tissue. Once in the brain, the ETX specifically kills the mature oligodendrocytes, the myelin-producing cells, leading to the demyelinization in these diseases, the team suggested. Now, on to our next topic. Cerebral spinal fluid meninges inflammation profile can stratify MS patients. A method based on cerebral spinal fluid measurements and magnetic resonance imaging, or MRI, can aid in stratifying MS patients with MS at the time of diagnosis, which may help identify a tailored therapeutic approach for each patient from early disease stages. What is it saying? It's saying that basis of the cerebral spinal fluid measurement and the MRI can actually, at the time of diagnosis, can help actually pinpoint tailored treatments for each individual patient early on in the disease. So individualized therapy. The data was presented by Roberta let me try to not kill her last name. Magliozzi from University of Verona, Italy, on March the 2nd at the 4th Annual ACTRIMS Conference in Dallas. Her presentation was titled Immunobiological and Radiological Markers of MS Endophenotypes. Degeneration of cerebral gray matter, the major component of the nervous system, consisting of the neuron cell bodies, is well tied to MS disease progression. So monitoring the disease progression. So the speed at which MS develops physically and cognitively in both relapsing and progressive stages of the disease is tied to the degree of the gray matter degeneration. So, however, it's also known that the cell loss and inflammation are involved. How exactly these gray matter lesions occur and how to best image them through MRI is poorly characterized. Why? It's because most MRI machines available in the clinical setting, in hospital and in the MRI imaging centers, do not have magnets that are strong enough to image down into the gray matter, because they do the white matter. Mostly they will image your white matter lesions, which is on top, but deep into the gray matter, they will not image those. Most of the MRIs that are strong enough to image gray matter are more in the research setting because they are very expensive machines. Okay. Now, the speed at which MS develops physically and cognitively in both of these types of MS are tied to that degree of cerebral gray matter degeneration. Now, the recent studies suggest that extensive gray matter damage and more rapid disease progression are tied to high levels of inflammation in the meninges, the layers that line the skull and vertebrae to enclose the brain and the spinal cord with cerebral spinal fluid. Therefore, researchers in Italy hypothesized that the intracapsular inflammation in the meninges and the cerebral spinal fluid might have a major role in mediating cortical damage and rapid progressive evolution of the disease. That's what the team stated. The team combined MRI imaging data, neuropathical analysis, and cerebrospinal fluid measurements to investigate a possible link between the intrathecal inflammation and nerve cell damage in gray matter and the rapid progression of both MS and both MS patients at the time of the disease diagnosis, and samples from the post-mortem patients were analyzed. So the analysis of the meningeal infiltrates and cerebrospinal fluid samples in the autopsies of MS patients showed that the meningeal infiltrates are the main source of inflammatory factors diffusing through the cerebral fluid, the cerebrospinal fluid. These factors possibly mediate a gradient of cortical tissue injury from the earliest stages of the disease. Along with the meningeal inflammation, the researchers found that a specific cerebrospinal fluid inflammatory pattern was able to predict the degree of cell loss in gray matter in a subgroup of MS patients, either in vivo MS patients or in the post-mortem MS samples. Now, according to Magliozzi, the progressive MS cases with higher degree of the inflammation present increased the level of gray matter. The demyelinization, loss of demyelinization, loss of myelin, the protective coat that surrounds the neurons, and the hallmark of MS. Now, concerning the cerebral spinal fluid and inflammatory pattern found, the team further showed that the CXCL13, which is a biomarker of inflammation, was the most predictive marker of the number of relapses in patients and the appearance of MRI lesions. So overall, the results suggested that greater inflammation in your spinal fluid and the meninges, that really light coating, is linked with a greater degree of disease progression and cortical damage, both at the time of diagnosis and at death. So a specific combined spinal fluid and MRI pattern might represent a useful, and MRI pattern might represent a useful surrogate marker of meningeal inflammation able to stratify MS patients according to the level of the intrathecal inflammation and the cortical lesion load at diagnosis. So they will be able to predict that at the time of diagnosis using these tools. Now, asthma is more common in MS patients than the public at large, this new study finds. Asthma is specifically more common among patients with multiple sclerosis than in the general population. The increased prevalence was especially evident in younger and elderly MS patients, regardless of race or sex. This study was presented at ACTRIMS in a poster presented by Eddie Hall at Case Western Reserve University School of Medicine. The poster was titled "Prevalence of Asthma in Multiple Sclerosis, a United States Population-Based Study." According to Hill, the MS patients often have the comorbid conditions such as hypertension, depression, anxiety, and other autoimmune disorders like thyroid disease and psoriasis, which adversely impact long-term outcomes. Asthma is a chronic disease characterized by swollen and inflamed airways that cause difficulty breathing, like MS, can diminish a patient's quality of life. But its prevalence in the MS population is not clear. Researchers at Case Western Reserve sought to characterize the prevalence of asthma in MS population in the United States. The team used electronic health record information covering 56.6 million Americans available in the IBM Employees EMP, which is their Explorer database, the Explorers. This enabled researchers to research and browse information about both asthma and MS diagnosis and the patient's demographics. The analysis was done taking into consideration age, gender, and race. In total, the researchers examined data from 141,880 patients with both MS and asthma, and compared the findings to data from a general population of more than 56 million people. The results showed that the prevalence of asthma was significantly higher among MS patients compared with the general population, like 16.5% versus 6.7%. After adjusting results for age and gender, asthma was found to be almost 3 times more common in MS patients than the general population. In fact, its greatest prevalence was found in MS patients either younger than age 30 and older than age 80. This pattern held regardless of the patient's gender or race. Asthma is significantly more common in those with MS than in the general population, particularly in the young and the elderly, irrespectively of gender and race. And having both MS and asthma may impact daily functioning, quality of life, and prognosis of patients, Dr. Hill said. He emphasized that the results showed the need for continued research and comorbidity management as a part of comprehensive MS care. He also noted that the co-occurrence of MS and asthma is not unexpected considering that both diseases have increasing incidence of and the increasing prevalence of overlapping risk factors, including genetic factors, tobacco smoke exposure, vitamin D inefficiency, and of course obesity, which are common risk factors for MS. Now, the next and final topic for our ACTRIMS review is the evobrutinib significantly reduces brain lesions in relapsing MS phase 2 trial shows. Evobrutinib, the new oral candidate for relapsing remitting multiple sclerosis, is safe and can significantly reduce active brain lesions over a 24-week of treatment, results of the ongoing phase 2 study showed. Dr. Xavier Montalban with the Van Helbron University Hospital in Barcelona presented the results in the talk Primary Analysis of Randomized Placebo-Controlled Phase 2 Study of Bruton's Tyrosine Kinase Inhibitor evobrutinib in patients with relapsing multiple sclerosis. It's developed by Merck and is highly specific oral inhibitor of Bruton's tyrosine kinase, which is called BTK, easier to say, PDK, which is vital for the development and functioning of several immune cells. These include the antibody-producing B cells and the macrophages. By inhibiting BTK, evobrutinib it suppresses the autoantibody producing cells, a common feature in autoimmune diseases like MS. According to Montalban, the preclinical studies in animal models of MS suggest that the evobrutinib could reduce inflammation in the central nervous system and amyloid disease severity. The ongoing Phase 2b trial, sponsored by the EMD Serrano Research and Development Institute, has enrolled 267 patients ages 18 to 65 with active relapsing remitting MS, either relapsing remitting MS or secondary progressive MS with relapses. The aim is to assess the safety and efficacy of evobrutinib compared to a placebo. Participants were randomized to receive either the evobrutinib or the placebo or Tecfidera. So when they used the Tecfidera as the control. A disease-modifying therapy that was approved for RRMS, as you guys probably know. Those in the evobrutinib group were receiving one of 3 doses, a low, middle, or high dose for 48 weeks or 11 months. Patients in the placebo group received a placebo for 24 weeks, followed by a low dose evobrutinib for another 24 weeks. Those in the Tecfidera group were given a 120 milligram capsule twice a day for 7 days, followed by a 240 milligram capsule twice daily for 47 weeks. The study's main goal, or primary endpoint, is the number of active brain lesions in the 3 groups at different stages of treatment, weeks 12, 16, 20, and 24. Secondary endpoints are the assessments of the annualized relapse rates and the therapy's safety profile. Nearly all the patients enrolled, 244, completed the 24 weeks of treatment. Now, the treatment-related adverse events were similar between the low and mid-dose groups and the placebo, but higher for the evobrutinib 75 milligram given twice a day. The most common was an increase in level of liver enzymes indicating possible injury to the liver. All adverse events were reversible and asymptomatic, the team reported. Now, the evobrutinib was seen to be well tolerated without any cases of serious infections. Overall, the findings support the BTK inhibitors as a potential oral disease-modifying treatment for relapsing remitting MS. And of course, the secondary progressive that they studied. The observed benefit risk profile of ibrutinib supports further clinical development. We are proud to participate in the important scientific exchange at ACTRIMS as it aligns with our commitment to advancing MS science to address the patient needs, that's quoted from Dr. John Walsh, the Vice President of Neurology and Immunology in U.S. Medical Affairs at EMD Serrano, in his press release. All right, now, thank you all for joining me for my ACTRIMS Review 2019. And for further information, you can go to msandmemedia.com. That's msandmemedia.com. See you again next week, next Sunday at 3 p.m. Eastern Standard Time for another episode of MS&Me Interviews. Good evening.